Welcome to the office. Hi, Jamie.
Hi.
Welcome to the office.
Thank you so much.
How can I help you? What you doing here?
Well, I'm so excited to be here, number one.
Thank you.
I have a lot of issues going on, one being my nose.
Okay, what's up with your nose?
I can't breathe properly. It's
right
hard.
side, left side, both sides?
I feel like it's the right side, but it switches sometimes.
Okay.
And then I also have some issues going on in my neck.
Before we get there,
Yeah.
tell me when the nose started.
That's a good question. I feel like it started at a young age when I used to blow my nose and hold one nostril. Then I also fell on my face
When was
and
that?
chipped a tooth. When I was like 9, I chipped a tooth
Okay.
on the right side,
Okay.
and I had to get a cap put up there. And I feel like maybe when I fell on my face, something might have happened there too.
Okay, so around 9, 10 is when you started to feel breathing stuff going
Yeah.
on. Okay.
Mhm.
And you were having trouble on your right nostril or your left nostril?
I feel like it's the right. I feel
Okay.
like it's on the right side.
Okay.
And
Meaning you have more trouble taking in a breath on the right side.
Mhm.
Okay,
But
got
then
it.
sometimes it can be the left. Sometimes it.
It switches.
Yeah.
All right.
Mhm.
How about taking in the breath when you can? Like, can you get a
I can, but it's like difficult.
just at the nose? How about the lungs?
The lungs too.
Okay, that's what I
Yeah.
thought.
Mhm.
Yeah. And that's been since 9, 10 as well?
My
Or
lungs.
that's more recent?
That's well, I would say within the past 10 to 15 years.
Okay.
Honestly.
All right. Okay. What else?
Have some issues going on in my neck. I can feel just some pain and some discomfort at times, and also my back because I have such large breasts.
Okay.
It's always an issue, my mid back and then my low back as well because it's so curvy. So
What you doing for it?
Well, I'm a massage therapist, so I have a lot of things I do. I
Okay.
massage myself. I do cupping on my back.
Okay. You
I
do
do
cupping yourself?
On
or-
my back,
Oh, right on.
myself. I do
Okay.
gua sha on my back.
Nice.
And then I ice it, I put hot packs on it, and I
Okay.
stretch it.
So, number 1 is the nose, number 2 is the neck, number 3 is the back, low back.
Yes.
Any radiating shooting pains down the leg, any foot, knee issues,
Oh
ankles?
yeah.
Because we were taking
definitely.
x-rays upstairs and you were complaining of your knees.
Yeah.
Was that from what?
I feel like there's a hip, knee, ankle, and toe issue.
It's all connected.
Yes. When I was 10, I used to sleep with my legs facing the wall, and I used to bang my knees when I would sleep for some reason. I don't know.
Okay.
And one morning I woke up and I could not straighten my left knee for like weeks. I couldn't
Okay.
straighten it. But when I sat down, I could straighten it. But when I walked, it was like bent. And ever since then, I feel like one leg is shorter. And
Okay.
then also, I feel like that's something going on with the knee. But then also, I injured my toe about in 2015.
Which toe? The big toe?
Yeah, the big toe. And I was climbing over some kind of fence or something, and a chain
You were
yanked my ankle.
climbing over some kind of fence.
Well,
There's some story there, isn't
It is
there?
a story.
Okay.
It is a story. So I was not a fence, but one of those chains that block off the parking lot. I went over it, and so the chain yanked my ankle back, and then
Yeah.
it hammered. My toe got hammered into the ground, and ever since then I've had pain in my toe.
Big toe?
Yes,
This one here?
and it is a bit of a hammer toe.
Okay, on here?
Yes.
Or on the bottom as well?
Both. Yeah, but
And
yeah.
if I follow it here,
Mhm.
right
Oh
there.
yeah.
And you can sit back there
Okay.
for me. And if I check the ankle, let it relax.
Okay.
Tender there.
Oh yes.
Not so bad there.
Not so
There's
bad.
an old ankle sprain here too.
What? I
Let's
did
see.
sprain my.
Yep, there's an
Oh.
old ankle sprain. Let's
What?
check this one out. There's an ankle sprain there too.
Ooh-wee.
Outside is okay, you twisted it. It's an inversion, both sides.
What?
We'll deal with both of them.
Wow.
Okay? Alright, what else? Anything else? Jaw?
I think you know what?
Or you want me to-
I do have pain in my jaw.
Right
I
side,
clench.
left side?
I don't know which side.
Okay.
I just feel like they're both tight.
Can I ask a very serious question?
Yeah.
Why here, why now?
Why here? Why now?
Mm.
You know, I'm getting older. I'm in my 30s. I'm getting older, and I want to.
Because it's not easy coming here.
No.
I get it.
It's not.
So why now?
Well, I feel like fate led me to you. I feel like
Interesting.
because I don't I don't want to go to just anybody, and I feel like I don't know. I'm just feeling like you could just. I don't know. I'm feeling really great energy from you, and I feel
Okay.
like, from what I've seen, you know how to get the job done.
Okay.
And I feel like right now is a good time because I just want to. I'm in pain, and I don't want to be in pain when I have to make someone else feel good and massage them.
Correct.
I don't want to be in pain.
I feel you.
And I'm
Yes.
also a professional dancer. I can't do my job properly if my body is not working.
Where are you dancing?
Well, right now I'm just in dance class because I'm on tour. Because
Cool.
I'm not like, I'm just doing massage
You're
right
practicing and you're doing massage.
now. Yeah, but I do both
When you go on tour, you said?
in 2 weeks.
In 2 weeks.
Yeah.
So we got just 2 weeks to get you sorted out
Yeah.
the best we can.
Yes.
Okay, then we'll deal with it somewhere along the
Yeah.
way.
I get tired of being in pain while I'm with my clients, and it's like enough is enough.
Okay.
I gotta get this figured out.
You ready to start?
I am.
All right, so here's what we're going to do. We're going to go over your x-rays
Okay.
and explain what I see, watch you walk,
Okay.
do our exam, and figure out where we're going to start.
Nice.
Let's look at her posture. Let's look at the overall appearance. Now, this is our posture line. When we're running the posture line, it goes through the center of the lowest lumbar.
Okay.
This should be going through the neck right there.
Wow.
It should be going right here. So it's that far off on the x-ray, okay? And what that's telling us is you carry your upper body behind your foundation. Now, here's what's interesting. You're saying you're heavy-chested. I'm using your words, right?
Yeah.
Okay. So, here's what's interesting. It's actually helping your spine right now.
What?
It's not hurt in your situation at the current moment. It's actually helping the spine because it's bringing you forward. If not, you'd be even further back. That's what's interesting in your case right off the bat. This is you right here, right? You see that?
Yeah.
So it's bringing you slightly forward. The issue we need to see is, and I kind of see what's going on here, is as we start to bring the spine forward, then it's really going to bother you. Then we got to make some other decisions.
Right.
Okay?
Of course.
You got it?
I got you.
But right now, it's helping your spine. Got it. Okay. And we're going to come back to this x-ray.
Okay.
Let's go over here now and talk about this. The good news is she has a good meganblasy, good gastric air bubble. We have a little bit, it's a good thing. So this is the air bubble of the stomach. It should be that big. So if you look at some of my videos, I talk a lot about the gastric air bubble, and most people have little tiny ones. So it's good in your case.
Okay.
For digestion. Digestion is a little bit off. You have more inflammation in the body than digestive issues. I'm assuming you eat clean.
I'm on detox right now.
You are on detox?
Yes.
Maybe that's why too. How long have you been on detox?
2 weeks.
Let's go to your analysis. Now this should start to make some sense. We have a rotated pelvis and a rotated sacrum.
Oh, Lord.
The good news is your hips are pretty much level. That's the great news.
Okay.
So your base is level, but here's what's happening. I'll reference the right side. So your right side goes down and turns in. Your sacrum on the right side goes back right. The overall effect is your body wants to go to the right side, ma'am. You favor walking to the right.
I do?
However, you have the tailbone, whatever happened, it rotated back and it's slightly down on the left. So it's dropped a little on the left. So I'm pretty sure when you walk, it's a little bit off in a wiggle.
Yeah.
A little bit of a wiggle going on. But here's what I want you to see. It's rotated right. It's going back on the right. The right pelvis goes down and turns in. The fact that it's down and in tells me there was a trauma. You had a couple of traumas in your pelvis and your low back. I know that.
Wow.
Okay, let's continue. The way the shape of the joint works, normally when it goes down, it wants to go down and out. It wants to go down and out.
Okay.
Up and in, down and out.
Yeah.
Your left, it's the opposite. And I don't know which one we're going to adjust till we examine you. Left side goes up and out. Sacrum goes back on the right. You see, so it's favoring the right side.
Wow.
But because the sacrum has dropped a little bit on the left, it wants to come back. So we got a little bit of that wiggle when we walk. Okay. Does that make sense so far?
Yes, it does.
Okay. Let's go back over here. Now, so we're tilting slightly down here. L5 tilts a little bit on that right side, contributing to the slight curvature to your left side. As we go up the spine, the body compensates, wants to come back to neutral, but then it curves again here, it curves again here. All this is compensation to your foundation. Now, as we go up, jaw looks decent. Looks a slight deviation on the right, but a little decent.
Okay, then.
I do see you have a little bit of a critical atlas, and that's going to contribute to your breathing.
What?
Now, your C2 wedges on the left side, your atlas wedges on the right. You can see this capsule of C1 here. It's thicker than on this side here.
Yeah.
So we have some swelling and irritation on this right side. But if I find an upper cervical on the right, I have to set C2 first to give it a better foundation to sit on.
Okay.
So here I'm seeing a C1, C2. Okay?
Okay.
We have a little bend in the nasal, or in the septum up top. No problem. We have the foundation we need to deal with, and I'm just checking through here. Now, the good news is I don't have any side slits, but I don't have any blunt traumas going through here. That's the good news.
Yes.
But something happened in your low back. We're not getting the whole story now. That's okay. That's all right.
I have to think about that.
All right, you need to think about that, please. Let's go over the side profile. And here's, I mean, this is actually pretty impressive. Your discs are great. These discs are good.
Okay, good.
But what I want you to notice is this. They're tilting, right? They should be level and parallel like that one.
Got you.
Okay? And where it's coming from, let's zoom in over here. You got a bent tailbone coccyx here. You have an S1 sacrum issue. So the rotated sacrum is an issue. You see this bend in the tailbone?
I do.
So it's got this one. You had some trauma, lady.
What?
You think about it. Sorry, but that's that's what I see. 5 is tilted. 4, 3, 2, 1. 12 comes back. 12 is still. 11, 10. So everything from your sacrum to your T10. This is all compensation.
Wow.
To T10. T10 levels off. Then we'll figure out what's going on from there.
Okay.
As we go up, but here's the good news, the discs are all good there.
Oh, thank God.
They start to thin out a little bit here.
Yeah.
Okay?
Yeah.
You see that? And I believe that's part of the wear and tear your body's going through.
Yeah.
Okay. Look at your neck. It's starting to go in the reverse order.
Exactly.
It needs to be going forward.
Right.
You already know that, right?
Yes, I do.
Okay. But the good news is your discs are good, ma'am.
Oh, good.
That's all good.
Good.
Now let's go over flexion, extension. So we have upper cervical C1, 2. We have foundation sacrum issue. We have nose to deal with today. And now I want to just take a look over here and see. Okay, this is extension. In extension, we're fine. Let's go back to flexion. It all opens up fine. There's an oval whiplash there. Nothing we need to deal with. You're fine. I'm just saying. It's a story, right? There's a story. The way I look at an X-ray, it's a picture in time. It just tells me how that person has evolved in their life. And so the stories start to come to me.
What? That's amazing. I love that.
So, you ready to change the narrative?
Yes,
That's
100%.
Let's get started.
I love that.
You have any questions?
Nope.
Okay, let's get started. And go ahead and walk to the corner of the room and back a few times, please. Okay, just keep walking. Slow it down just a little bit. Just a little bit. Let's watch the feet. So you can see that the right foot flares out, but you can walk a little bit. Just whatever's your normal.
Okay.
Okay, whatever's your normal. So that right foot flares out. She swings it a little bit because of the drop sacrum on the left side. She swings that right a little bit. She's pronating that left. You
I am pronating the left.
You're pronating. Yeah. So you swing that right is what happens, and you pronate the left to compensate. And she kind of just walks side to side when you walk, okay? So you kind of just go side to side like this. And it's not this. It's not this. It's the foundation.
Wow.
Okay? If you want to turn around and just test something out for me, can you hold them up?
Yep.
Hold them up and go ahead and walk holding them just so we can rule that out, okay?
Right, okay.
Go ahead and walk. Now you can see it more. She drops on the left and wants to go right. Every time you want to go right, it drops on the left. There you go. Now you can see it better. Okay. Normal walk. Have a seat over here. Let's get started. Starting at the base of the neck. Oh, there it is. 25 points. Left side C2. 30 points. And that's where my meter only goes to 25. You're off the charts.
What?
No pun intended. There, starting to balance out. 20, 18 points, 20 points. Left C2. Yeah, we have a critical atlas. Sorry, I got caught in my.
Okay.
All right, so we have critical atlas up top. T6, T7, left side. Actually, more T6. You said you're detoxing right now, right?
Yes.
You changed your diet in the last 2 weeks.
Yes, I have.
Got it. You in for a treat today.
Oh, I'm so excited.
This is part of the area that controls your digestion, so
Mm.
it's going to speed up. 10 points, T6. Sacrum. We're down in the low. 10 points. We're down low. S3, S4. T6, maybe 7, C1, C2. So here, let's statically palpate. Static palpation. As soon as we get here, that's where your inflammation is.
Yeah.
That's it. It's not as much here as
Right.
here.
Mm-hmm.
There you go.
Yeah.
More tender. The top one is tender.
Yeah.
Bottom one.
Yeah.
More here or more there.
Oh, there.
Not as bad there.
Right.
Little bit there.
Yeah.
Definitely there.
Definitely. Yeah.
Head down, please. 7. 1, 2, 5, 6, 7.
Mm.
Let's continue down. Let's check down low. Let's check the pelvis. Slide forward, please. Open and close the knees. There you go. Right side only, please. When she does the right, the left wants to go with it. Left side only. You see that? When you do the left though, the right also wants to go with it.
Mm.
Go right again. This is more tailbone issue. Both are stuck, but tailbone is more stuck. We'll deal with the pelvis later. Let's check low back now. Back slowly towards me. That's 5. That's 1. That's 2. That's 3. Starts there. 3. I'm going down still, okay? 4. 3. No, 3 is good. 4 more tender. Right there. Yes?
Mm-hmm.
That's 4. Now let's look at 5. Not too bad at 5.
No.
S4, T7, let's check the next. 7, 6, 5, 4, 3, that's 2. That's 2. That's 1, it's 2. C2, you feel that now? C2, T7, and S4. We're going to start there first. We're going to clear the spine,
Okay.
then we're going to check the nose.
Okay.
Okay? I
Yeah.
don't want to, I'll put gloves on and then we'll deal with the nose. And we'll also start on your ankles today.
Okay.
You ready to get started?
Yes.
Questions?
Nope.
Showtime.
Okay.
Let's go face down over here. Shasha! Shasha! Should we give you a hard time, Shasha?
Not at all.
I'm just checking. I'm just checking. S4 with a little twist. Alright. Good. 1, 2, 4. There we go. Gonna come down. They're gonna go out, okay?
Okay.
No, I'm telling Shasha. That's just prep. And we gotta torque it up. And she don't fight. Ah, it's a piece. There you go. Thank you, Shasha. Thank you. 7, T7. Hold on. Nice. here for you.
That was intense. I liked it.
Walk it up.
Whew, wow.
Walk a few times, please, back and forth. Sit good.
Good.
One more time.
Yes.
Now let's set, and then we'll set C2. C2 we're going to set as fearless. You okay?
Yeah, great.
Someone's ready to come out?
Oh no, I'm good.
Sit
I'm
back
good.
for me. Good. Sit back for me. I'll work.
Okay.
C2. Do 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 do. Ch ch do 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 do. Gotta set it up. That's the home run.
Amazing.
Watch, there's a breathing point right here. Check this out. Sit up for me. It might be spicy for a second.
Okay.
This is the lung point. Go ahead and deep breath in. I haven't touched your nose yet. Take a deep breath in.
Wow.
Different?
What?
Now, I know it's spicy. Tell me
That's
which
good.
side is spicier. Which one's spicier?
Ooh.
Right or left?
Oh, I can't tell. I feel like
Both.
yeah, I'm like
Deep breath in.
Yee.
Deep.
Whew. Wow.
Walk it off, and then we're going to do your nose. As you're walking, just from what we adjusted, tell me if anything is different so far.
I feel like my back is like straightened. I feels a little bit lighter even. Wow. I definitely can feel something in there. It's
Deep breath
aligned.
in. Deep breath in. Okay, let's go over here on your back now. So you were complaining of the right nostril.
Yes.
Okay, but we're going to now check which part of the septum is bothering.
This is exciting.
Now, this is the nasal bone, okay? This is the cartilage there. This is the right side. This is the left side. I agree with you. It's there.
Do it.
This side is okay. It's not sharp when I do that.
Right.
But when I do that side,
Oh, wow.
it's stuck right there.
Yeah.
Okay.
Wow.
Let's do it. Now, she actually got a small nose there for me to grab.
I did.
Breathe through your mouth, okay? Chin down. That's a little bit. There you go. Still more. There you go. But I'm going to show you another connection. Watch this.
Oh.
We're going to follow it over here to that jaw. Open the jaw. Open. Right there. This is part of the breathing. Okay, close. Slowly open. Open. Left deviates, right compensates. We need to deal with your jaw now.
Oh, wow.
One of your homeworks is going to be steaming starting tonight.
Oh,
okay?
yes.
Steaming, please.
Okay.
Step
I
up.
love a good steam.
That way you can drain.
Wow.
Different?
Already.
Tell
Wow.
her.
I could.
Tell them.
Oh my god.
Tell them. They don't believe it's a real thing.
Oh my gosh. I have air going up my nostril.
They don't believe it's a real thing. It's a
Oh
real
my
thing. And you'll report back after tour what happened.
Oh my gosh.
Come on back.
I can actually, I feel like air is going through the entire.
Right side.
Oh my god. Wow. What? Oh my gosh. Oh.
Here's tissue.
Wow. Thank you.
There you go, man.
Woo-wee. Okay.
Yes, ma'am. Now we got to deal with your TMJ, okay?
Okay.
You saw why, though.
Yes.
Sit back for me, please. Look up, slowly open, open. Left compensates, right. Sorry, left opens up first, right is the compensation. We're going to deal with the right side. We're going to be applying lateral to medial pressure on the right TMJ. Open all the way. Close halfway. If anything is too much, you tell me to just raise your hand, okay?
Okay.
Open all the way. Close half. Hold there. There you go.
Oh my God.
There's a ganglion of cell bodies that sits behind there.
Yeah.
It can also produce pressure and affect a lot of the sinuses and a lot of the glands in the face.
Oh wow.
Open.
What?
Really
I felt that.
Open. Different.
Oh my gosh. What?
Now, keep breathing, deep breathing.
Oh.
Watch.
I can actually breathe.
Watch. Deep. Out. One more. Deep.
Whoa.
Out.
Mm.
There you go. Sit up straight. Let's rescope, make sure everything is clear for you. Actually, before we do that, let's do the shoulders.
Oh yeah.
Left side. That's it. Okay, grab a tissue for me,
Thank
please. Here. So we have the big one up top. She likes to dance so much, she got even a test to dance. No kidding. All clear. Do 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 do. 7 is clear. Sacrum is still got heat. We still got a little heat there. Let's feel, okay? Back slowly.
Yeah, rabbit, yep.
Back slowly, 5. S1, S2, S3. This is the one I did. Tender, better.
No, yes.
Yes, what?
I agree with you.
We'll need to deal with 5 next visit, okay?
Okay.
We can't do sacrum and 5 on PDA the same.
Gotcha.
I've done it in some cases sideways, but your table is going to be there right now.
Okay.
Okay, questions for today?
Questions for today. That the thing. What are you exactly measuring?
Heat.
Really?
So here's what we're measuring. Let's take the spine. That's a great question. A lot of people are asking, especially because we have a lot of new people watching the videos. There's a lot of people who, the older fans, know what it is.
Okay.
So the idea is this, okay? You have, this is the spine. These are the discs in between. These are the nerves that exit out the hole called the foramen. Okay, now as we're running the meter up and down the spine, what it's measuring, when everything is in balance, okay? There should be no difference in temperature left to right side. When we have misalignment causing irritation or inflammation, this is picking up the heat from the inflammation.
Wow.
So what happens is when we run it down, it gets to a hot side or an inflamed side, it's going to deviate one side, come back to 0. And that tells us where to focus the exam.
Amazing.
So, someone can have, I just posted a couple of these. Lady came in, she had upper cervical pain,
Yeah.
but the pressure was 7. We cleared 7, her upper cervical pain was gone.
Wow.
Right?
Amazing.
Same thing here. We found pressure at 7.
Yes.
You may have stuff here. I'm not finding it here. As this thing starts to hold, things will shift around.
Okay.
Your homework is very simple.
Yes.
Water, walking, ice. Lots of walking.
Yes.
10,000 steps a day or the
Okay.
best you can.
Okay.
The more you walk, the more your spine gets in balance or looks for balance.
Okay.
Swimming is fine. Elliptical with handles is fine.
Okay.
I wouldn't be doing any kind of weights right now if you're into that.
Yeah.
Okay,
Okay.
please, for right now.
Okay.
That's it. I'm going to work on your ankles.
Okay.
You're going to go for a nice walk. When we're done here, after every adjustment, 10-15 minutes, go for a walk.
Okay.
Next question they're going to ask is, what's this board doing? You can tell them, okay?
Okay.
What I'm doing is I'm using Gonstead contact points adjustments, using the board to absorb the shock. It absorbs, it allows me to go a lot quicker,
Okay.
a lot more high velocity,
Okay.
less pain to the patient.
Okay.
Okay? Relax the foot.
Okay, relax. Whew.
Relax the foot. Ankle.
Wow.
Okay? Raise it up.
Okay.
Raise it up. Fibula. Raise it up. I'm on the back side of the fibula. Setting.
Wow.
Come on up. Walk it off last time.
Wow.
And then I gotta give you the buff and polish.
The buff and polish.
Now you can tell us what's different with everything overall.
That's insane. Cause I feel
What?
I don't know, I feel like my right foot is going straight now versus it was going out. I don't know. Like
I'm not gonna say nothing.
I can feel it. I can feel it. I feel like before I was kind of walking to kind of like out. And I don't know, I feel different.
Turn around and hold them up.
Okay.
Okay, you can put them down.
Okay.
Good stuff. Have a seat. Let's buff and polish you out.
Buff and polish. Okay. Ooh.
This is vibration therapy, not percussion.
Okay.
When we go over regular tissue, it does nothing. When it goes over scar tissue or adhesions, you feel a little bit of that tickly spice.
Yeah. Tickly spice.
I mean, that's the only way I can really describe it.
Oh.
It doesn't hurt, but it tickles.
Yeah, I feel it in there. That shoulder for. Definitely feeling that shoulder.
Tickly spice.
Oh yeah.
Tickly spice. That's one of the spice. That's the Spice Girl that never got famous. Tickle spice.
Tickle spice. Oh my gosh.
Stand
I just have an hour of that now. That was
Stand
amazing.
up for me, please. Squeeze that
Okay.
one. Squeeze. Face me, please.
Okay.
Squeeze. Good. Squeeze. Just relax that
I
one.
don't know why I just jumped up like that.
You got up fast.
I did.
She got a little spring in her step now. That was interesting.
I know. I'm like, why did I do that?
I have no idea. Do you normally do that?
No. Oh.
Yeah. Squeeze. There you go. Now you're going to be able to do your job better.
Amen. Thank you so much.
You're welcome. Welcome to the office.
Thank you.